Good evening, everyone, and welcome again to our coronavirus update. We're here to answer all of your questions with Dr. Liello and myself. So I think let's jump right into it.
Yeah, sure. So I have a question. So how does it work when using elevators, the laundry room, the stairwell, all parts in an apartment building in terms of social distancing and keeping safe? And also, does the situation of living in an apartment make you more vulnerable to be around your family even for 14 days? So it's true. Ideally, we would all be able to kind of self-quarantine ourselves in a cabin far, far away, but close enough to our doctors, of course. But in reality, we all live in shared spaces. So in condo complexes, apartment buildings, retirement homes, that's sort of a lot of people. And theoretically, just with the flow of people, that puts you at a slightly higher risk of contracting the virus just because there's so many people there. Essentially, what could we do? So I would try to limit the amount of time that you spend in these shared spaces. So a lot of apartment building complexes are having these rules in terms of no more than 2 people in an elevator at a time, which is a pretty good idea. Same thing would be for those essential shared spaces like the laundry rooms, perhaps to put up a schedule, and that way people could just kind of pencil in themselves for a specific hour, and that way you don't have more than 2 or 3 people in the laundry room at a time. So it takes a little bit of initiative on our end, but those are ways that we could reduce the chance of spreading the virus.
That's a good one. I have one here. So my daughter is studying abroad in Oxford, England. She has self-isolated herself in her dorm room. She plans on staying in England to work on her dissertation. Is her staying in England a wise decision? Is traveling home more of a risk? Okay, so there's no right or wrong clear answers these days, but we would say probably, given the information we have in the balance, she probably is better off staying in England. She's safe there. She will self-isolate herself. Sure, they are a couple of weeks ahead of the pandemic than we are here in Quebec or Montreal or Canada. So I don't see any big advantage in coming here. The situation will evolve rapidly here to what it is in England. And I think the travel risk would put her at an unnecessarily increased risk. So I would say, stay put.
Yeah, perfect. Another question I have, so if I'm to start showing symptoms but don't require medical attention, do you recommend leaving the house to get tested? Does the government need to confirm my diagnosis? And I hear the importance of tracking is just very important. So it's true. This is a pretty complex question. Really, it depends on how readily available the tests are. So now that Quebec has ramped up the testing, so in Montreal and outside of Montreal, there's a lot more test centers available. I would say that if you're starting to experience symptoms, if you could safely get yourself to a testing center, in the meantime, maybe not using public transit and exposing other people unnecessarily to the virus, it would be worth it to go get tested. And the main reason why is that the only way we're going to really get a good eye of what's going on is if people are tested. So it'll help give us the visibility of what kind of monster we're really dealing with. And in the same light, it'll also help us know when we could finally return to sort of quote unquote our normal life, is if enough people get tested and we know that either people are coming back, more and more people are coming back negative, and the virus is not kind of as present.
That's a good question. As you can see, most of these questions are multi-level and multi-layered. They're not that straightforward. I have one over here. This is a very good question, actually. It summarizes a lot of independent questions we've been getting recently, but this member of the audience put it all together. When going out to get essential items, what is the safest way to do this? Most people are aware of wearing gloves and wiping down high-touch areas such as shopping carts. Do you suggest wearing a mask? What if we don't have one? Will a bandana work? Respecting distances can be difficult while out in public. even if we do our part, not everyone else does. Any suggestions to stay safe will be very appreciated. So multi-level, again, multi-layer question. Let's try to cover each point one by one. So let's start with going out. So my first comment would be, don't do it. Unless there's an emergency, you need to get groceries or gas or the pharmacy, or you absolutely have to see your doctor. Now, having said that, these days a lot of things can be done online. So I definitely suggest we try that as a first line of defense. And if you absolutely have to, then okay, let's go out. The second part of the question was gloves. I think as a general rule, that is a good idea. Now, for me, the gloves, remember, the gloves can get just as dirty as your hands. So it doesn't necessarily work in that way if you're still touching your face or whatnot and forgetting. For me, it helps me just to remind me not to touch my face. So when I'm seeing patients and actually when I'm out, you'll see me wearing gloves, and I think that serves as a good reminder not to touch our face. Then the third part of the question was wiping down high touch areas outside. Well, if you wanted to get our guide to wiping down what we consider high touch areas inside your house, you can ask for our coronavirus guide. And this refers to high touch areas outside of the home, like the audience member said, shopping carts for sure. That's a common one. Now, stores are doing their part. They're trying to have a separate entrance, a separate exit. They're trying to protect the cashiers. At the same time, they're trying to have lines marking people at the cashier's line 6 feet apart. Maybe you want to wipe down to the credit card terminal. Maybe, you know, it's hard to think of all the spots inside, but the freezer door handle, you want to think about that. That seems to be a shared space. How about a mask? Okay, now this is $1 million question. We've been hearing a lot about this, and you've been hearing a lot about this. This is how I would summarize it. I think everybody now has learned there's 2 kinds of masks. You have the surgical blue masks, which is loose fitting and kind of loops behind the ears. And then you have the N95 mask. So the surgical mask's role is to protect others when you're sick. So your cough droplets do not go and hit them. It doesn't do anything to protect you against the against the coronavirus, exactly. But the N95, here's where it becomes a little bit controversial. The N95 does protect you. Nothing is perfect, but the studies show it decreases your chance of getting something airborne by about 5-fold. So it does do that. And in a perfect world, yes, maybe we would all have an N95 mask before we went out. But then again, nothing in this world is perfect. You know, just nobody should get sick. None of that is fair. And yet we all have to deal with that at various points in various levels in our life. So the N95s are in limited supply. If the main manufacturers alone had to produce for everyone, it would take years for them to make enough for the whole population. So that's not going to happen. They need to be reserved for the healthcare workers who are in the front lines. So that would be my comment on it. Having said that, if you don't have an N95 mask, I wouldn't be too worried because you're outside, you're not up against sick people, they're not all lined up like the healthcare workers in the front line are facing, and you could do your best to keep 6 feet apart. That gives you about as much protection as an N95, I would figure. Does a bandana work? I would say no. Yeah. I don't think that's worth looking into. And respecting distances. Now, respecting distances, it's a challenge when you try to keep 6 feet away from somebody to protect yourself and others, and the others are not. But I think to the best of our ability, let's keep doing that. I think most people these days are not insulted. It's top of mind. They're very aware. And it's just a question of, you know, politely asking people to social distance themselves and leave you a little bit of space. I think that pretty much covers that question.
Yeah. I've seen people go around with the bandanas, with the scarves around their face, and honestly, if you really look at them, it looks like they're probably touching their face even a little bit more because they're wrestling with the scarf. They're trying to fix the bandana, so it's a little bit of an irritating thing, especially if you're going indoors. So it's probably best to just stay away from that. Just don't touch your face. One of the last questions we got for today. So my parents, 80 plus with medical issues, are high risk. They are in self-quarantine. They have a big house with a full apartment in the basement. My sister-in-law is living in the basement and not in quarantine. Is this safe for my parents? So this one seems a little bit more straightforward. I would say that if they really are separate spaces, and your sister-in-law has no contact with your parents, then I would say that that's reasonable to say that they're safe, really just to limit that contact. If you think about it, even some cases that come back positive for the coronavirus but have mild symptoms, the recommendation is they could still go back home, but they have to now isolate themselves from the rest of the family, put themselves in a separate room with proper ventilation, and take those precautions as we've kind of highlighted before in our handout. So that seems safe to me. I think we're gonna end it there today. Thank you again, everyone, for all the questions. We're here all the time to answer them, and I'll just end on something that our Prime Minister Justin Trudeau had said. So I like the way he said it. He said like go home and stay home, and I'll just add, stay home and stay safe.
Take care.